Attorney Jonathan Elson, reminding you that if you've been injured in an auto accident, it's important to have somebody on your side. When you need a lawyer,
then you need Nelson.
Pahrump has one of the highest percentages of people over the age of 65 of any community in the United States. According to the Census Bureau, it's 25%. So that's a tremendous percentage and much higher than the average in the United States. So these are people who invariably are going to have cardiovascular problems. About half of the population over 65 is going to have an active cardiac issue. So managing that, getting advice about that, getting tested for that would all involve going to Las Vegas, which it has been for years, until I came here, until Dr. Siegel preceded me here, who was providing those services too.
And then, can you describe some of the challenges in providing cardiology in our community?
Well, there are many. As a cardiologist, one is used to working in a big city environment where when anything happens, you can rely on a big hospital with cardiac laboratory, surgeons, etc. So when you work here, you have to be very creative about how you use services, who you decide really needs to go to the big city for advanced care. And I think one of the advantages of having someone like me here who has worked in small towns for almost 30 years, in addition to working in big city hospitals, is you know when someone really needs to go. And bringing that expertise here, we've actually substantially decreased the number of transfers from Pahrump to Las Vegas. The hospital has that data. I think it may be 30 or 40% decrease.
What's the kind of criteria that you have decided? Because I'm sure that there's a whole different type of level of care of what you decide this person needs to be transported and this person can stay.
Well, I'll give a very concrete example. A person goes to the hospital with chest pain. This is a common reason to go to the hospital. We know 50% of chest pain episodes are non-cardiac. Previous to us having this program here, many of those patients were simply transferred for the evaluation. Now with echocardiography, with sophisticated nuclear medicine, which is as good, frankly even better than some of the institutions in Las Vegas, we can do that initial screening here in Pahrump, and many of those patients can then be safely discharged the same day or the next day from the hospital.
So are you here full-time then?
I am. I live here, and I work at the hospital 5 days a week. We divide the weekends up between myself and Dr. Siegel, so we actually have coverage 7 days a week.